Mental health experts and neuroscientists have convened in Nairobi to explore innovative solutions and strategies to promote brain health in low and middle income countries. The conference, held under the theme Healing the Brain, Bridging the Gap in Low and Middle Income Countries, will also address the obstacles that countries in the Global South face in addressing brain health issues, including access to care, insufficient research, development and funding, among others.
Health's Mental Health Investment Case 2021 put the burden of mental health conditions at 62.2 billion shillings, a cumulative cost for medical bills for mental health conditions, lost productivity through absenteeism and premature deaths. In lower income countries, only a third of national health insurance cover mental health conditions such as depression, and there are just 2 mental health workers for every 100,000 people, according to Aga Khan University President, that is Dr. Sulaiman Shahabuddin.
So I think one of the outcomes that I think that all of you should debate is how do we increase the resource allocation to the low-income countries. Here in Africa, mental health research constitutes just 2% of all health research, 2%. Yet the continent's suicide rate is the highest of any World Health Organization region. So we need to identify cost-effective interventions for priority conditions if we can strengthen multi-sectoral promotion and prevention for all.
The director of the Brain and Mind Institute, Professor Zul Merali, observed that the burden of mental illness is the largest of all diseases put together.
The availability of highly specialized therapists and treatments are unacceptably low. Our focus is on brain health and mental health. The BMI's ethos is to span from the neuron to the neighborhood, and also across our multi-country campuses in Africa and Asia.
Professor Lukoya Toli, the Deputy Director of the Brain and Mind Institute, lauded the conference as a step in the right direction to address the challenges facing brain health in low and middle income countries.
This conference, therefore, has been put together to bring those of us from low and middle income countries together to think about what needs to be done to change this narrative in this country. And the Brain and Mind Institute is growing into the knowledge partner for the Kenya government in implementing the research mission, in implementing the knowledge mission, in implementing the advocacy mission that the task force recommended.
The Brain and Mind Institute, through the conference, hopes to rally communities, governments and practitioners in developing countries to make great strides in prevention, treatment and awareness efforts to the silent pandemic of mental illness. Maria Ambo reporting for KBC Channel 1.